And thank you, Hannah. We will have time for some conversation at the end after this webinar. And Faye and Hannah are supporting us today, as always, and will be monitoring any comments in the chat, or I might draw on them just to clarify some things for us. So welcome. Thank you for taking the time to join us. Either you're joining us because you have recently become a member and registered with the Nursing Now Challenge, or perhaps you are interested in doing so. Either way, we are delighted that you have joined us. We are joined with by a couple of our Nursing Now Challenger Committee leaders. So we have Lincoln with us today, and we have Ratna, and they will be introducing themselves to you. And we have Mohamed, which is wonderful. So they will all be, we'll be asking them to share their experiences, because whilst I can tell you about what Nursing Now Challenge is and does, the most important thing is to hear from the people, the early career nurses and midwives who are either students or registrants in different parts of the world or from different parts of the world. What is their experience of being with Nursing Now Challenge? What has that what have those opportunities done for them, and how that is evolving and continues to evolve. So I think hearing from them really will make it come alive. So I have a few slides to share with you. So the network itself, let's think about where is the network, what is the scale of it, and where is the reach. So we are a global network, a global community of student and early career nurses and midwives. And our mission really is to provide opportunity to early career nurses and midwives, whether they be students or registrants across the world, provide them with opportunities for personal professional development, which in turn enhances and strengthens their leadership and offers them an opportunity that they would not necessarily have currently in their current role, in their country, in their organisation, unless their organisation, of course, is part of the Nursing Now Challenge. So the network covers 131 countries, so we have representation and members within 131 countries. We are now more than 218,826 members, so almost heading towards 250,000, which is a significant number. Our members are made up of 1,190 organisations. Those organisations are largely universities with students, or hospitals or groups of hospitals, health boards, community groups of care facilities, etc. Basically employers of nurses or educators of nurses and midwives. We also have 1,220 individuals. So their organisation may or may not be a member, but they have decided to individually join, and we encourage that within all organisations. Our new countries, the reason that we're managing to creep up to 131, as you can see, are varied. Ecuador, Nicaragua, the Netherlands, Yemen, Libya, Burkina Faso. We are really reaching now the far corners of the globe, but as you can see from our map, there's still a bit of work to be done in some regions, Africa, the northern part of Europe, etc. So we've still got a few places to infiltrate, which hopefully you may represent some of these areas. Next slide. In terms of who we are and our governance, we have an advisory board. We are a very flat structure. So we have an advisory board, then we have our regional leads and hubs, and the Nursing Now Challenge itself, the community, and there's the team here at Nursing Now Challenge, myself, Faye and Hannah. Our board is made up of nurses and non-nurses. They are in significant leadership positions across the globe, either nursing associations, hospitals, universities, former chief nurses in countries. And we also have Amy and Sana, who are co-chairs of the Nursing Now Challenge, and They sit on this board, having formerly been within the Challengers Committee. Amy is hopefully joining us today. Sana cannot because she is training currently to be a midwife and she has a class this morning. Otherwise, she would have joined us. Our advisory board also have associates who work with them. Across the regions, we're still appointing to those positions, and that really reflects our size increase in our numbers. So as the numbers grow, we need more of a resource for our regional hub leads to engage with and support the work that we are doing. So the people you see in front of you now are very much involved in Nursing Now Challenge, and they would be open to you contacting them once you become members, if they are within your region or country, involved in supporting you in your activities. Next slide, please. So the Challengers Committee is a sub-part of Nursing Now Challenge. We have our big community of nearly 250,000, and then within that we have the people who have joined individually have self-nominated themselves on registration that they would like to be more involved. They would like to actually do more things. And that really is the engine of the Nursing Now challenge. They drive forward their regions, they take on the leadership role of their region, and these are early career nurses who are working. They have a job, they are either studying, working, and they also have this wonderful role that supports the work of the Nursing Now Challenge. So the Challengers Committee is made up of nearly 400 student and early career nurses from 61 countries. They are the ones driving and forging ahead with a lot of the agenda and activities that we are doing in their countries and their regions, and they're supporting the work of the Nursing Now Challenge. And we are joined by three of them here today, which is wonderful. Next slide, please. So this will help you see if you join, you will join into one of the regions, your respective region. We have a case of diaspora. So some people, for example, will be from a country in another region, but they will be working in another region. So it depends where you want to sit. But if you're an organisation, you will sit within your region. The regional hubs all have early career nurses and midwives leading them, as I have identified, and we can, Kajatu in England, lovely. And we're about to meet them in visuals. The next slide will show you who they all are. We're going to put a face and picture to these individuals. And there's Mohamed there in the picture, emergency room nurse, and coming from Sudan. And you see many of our nurses now are working in conflict zones, increasingly so. However, how wonderful is it that we are still able to see and be with them, support them, and help work together for the greater good and for the other nurses who are working under these very difficult circumstances. Ratna down there, Southeast Asia, you can see, and Lincoln had been on another page also. Next slide, please. And we have a couple of vacancies there in the other regions. So when you're thinking about, well, what happens when I join Nursing Now Challenge? So there are two different parts here. If you are somebody who is an individual in the audience today, or you are a member of an organization, it will mean different things to you. If you are an early career nurse, student midwife, you will be able to access all of these resources, take part in all sorts of wonderful opportunities. And then if you're an organization, you are thinking, well, what do we do with this? And actually, you can do anything you want. I think the key focus is, if you're an organization, think about your workforce. Early career nurses and midwives, what do they want? What do they need in terms of their development? This is an opportunity for you as an organization to offer this community, to offer these resources. You don't have to do anything. You just share the information, tell them that your organization is now part of Nursing Now Challenge, which I think demonstrates you are a forward-thinking organization. And for your early career nurses and midwives, I'm sure this will encourage their retention with you, their work. It will bring so much personal and professional development to them, which will only enhance the working environment. So we have something called the Global Solutions Initiative. This is a wonderful opportunity for early career nurses to identify that they are interested in coming up with a solution to a global challenge that we have set. And we do that in partnership with other organizations. So again, you don't have to do anything. We do all this hard work and then we offer these opportunities. We've recently done one in partnership with the World Health Organization around disinformation and misinformation. We saw a lot of that within COVID and vaccines, and we're seeing it definitely now with the pandemic accord, which the WHO are trying to push forward with member states and sign off. Our most recent one is around HPV vaccines, working with Sabin, which is one of the world's leading vaccine advocacy organisations. And we're just about to announce the winners of that. And there are opportunities and prizes for the winners, early career nurses, showing us that they have got great ideas and they have got lots of solutions. And this is an opportunity to showcase and give them a platform. They are wonderful. Then we have Health Action Training, which is art and drama together. And we're going to just hear a little bit from some of our members who have taken part.
Action Training provides specialised communications training for nurses and midwives. We draw on applied drama, actor training, and person-centred practice to help you communicate effectively, manage stressful situations, lead on solving problems, and learn from perceived failures. We're pleased to partner with the Nursing Now Challenge to bring our unique training to members of this global network, supporting nurses and midwives around the world. Our bespoke courses are accredited by the Royal College of Nursing, the CPD Standards Offices, and the Nursing and Midwifery Board of Ireland. Over 95% of our participants strongly agree that our courses provide a positive learning experience. For many, it's game-changing. And thanks to the support of the Burdett Trust for Nursing, it's completely free of charge.
My learning journey began with health action training, and arriving at my third course with them, I feel more positive. At personal level, I'm more resilient.
The experience in itself was something extraordinary. It was just amazing, and I feel like I'm a better person for it.
To learn more about our approach and register for an upcoming course, visit the Nursing Now Challenge website.
So you hear there how transformational this opportunity has been. It's one of our most successful offerings, resources, and it is offered at different levels from very much entry level up to a certificate, a credit bearing certificate, and a hugely successful and wonderful opportunity for people. Next slide, please. We also have the debate, so this is an opportunity they're launching this year. They've been identified as key areas for our membership that young early career nurses want to talk about. They want to have a debate about our profession and things that impact it. They want to have a voice and they want to talk about that. So we're offering that opportunity to enhance that voice, give them a platform, and hopefully it will strengthen their ability to engage with wider audiences outside and within the profession as part of our hope that they will influence change and lead change. Next slide, please. And we have our book club, hugely successful, and we have a range of authors who will engage with us. Here is our example of some of them who have written books that are very relevant to nursing. And our early career nurses get the opportunity to work with the authors, read specific chapters, and with the audience within who attend the book club, they will discuss, again, trying to stimulate ideas, conversations, broaden our understanding of topics that are meaningful for nursing, and trying to engage early career nurses and midwives with the idea that they have got the opportunity to impact and to influence conversations and be engaged with authors, or often individuals who they perhaps wouldn't have been able to before. So it's about offering that. It's wonderful. It's a wonderful space for and time for sharing thoughts. And our next session will be with Dr. Barbara Stillwell, who was former exec director of Nursing Now campaign, and she has just published a book about global nursing. And in fact, Zipporah, one of our regional hub leader Africa, she has contributed to a chapter in that book about the future of nursing. And that will be one to watch, and it will be hugely exciting to be part of that conversation. So the 6th of March at 2 p.m, you can find details of that on our website. Please encourage others to join and see what that is about. Next slide, please. These are just a few highlights of 2024. We celebrated International Nurses Day by giving back to our nurses with some wellness events throughout the day, an art therapy session, a self-compassion session, a networking session, and some bespoke health action training work, which was wonderful. We are working with WHO and other partners, Sabin, for example, on the Global Solutions Initiative. Our regions, we run sessions and different events, but also our regions do that too. And that's great. If you're in the audience today and you're thinking, well, what's happening in my region? Your region, you can engage with your region and you can get to know the people there. You can join the Challengers Committee and be involved. There are two regions who are currently have a webinar series, one on research in Emerald region and one on nurse education in Western Pacific. So that's where you'll find out where you're hearing more about things that are relevant in your region, perhaps. We had our welcome webinars and we invited different people to them. We had Dr. Amelia from this WHO, the chief nurse, and mostly we have our Challengers Committee because they are the people that you want to hear from, we feel. Next slide, please. Upcoming events. Biggest event for nursing in the world this year will be the launch of the State of the World's Nursing Report. It will launch in April from WHO. In fact, the WHO Executive Board is meeting this week, and I know on Saturday, and you can join these debates, that nursing will be on the agenda at the WHO Executive Board. And ICN will be presenting. Howard Catton will be there talking about nursing and the importance of investment and working conditions and nursing safety. And they will be discussing the SOAN and the SDNM, the Strategic Direction for Nursing and Midwifery. I've just heard that this morning from WHO. So please, if you can join online for that. Go to WHO or Google WHO Executive Board and find your way there. We can also maybe send some details of that out to you. We've got book club with Dr. Barbara Stillwell. Nursing Now Challenge, just to say, will be heavily involved in the launch of the State of the World's Nursing Report across our regions, led by our regional hubs. And we would love for you to be part of that. And we will be launching Nursing and Midwifery in Crisis series. We're just having some focus groups with our stakeholders around from other countries to talk about what that might look like. And we are going to be launching new podcasts, which is a new thing for nursing. And I know Lincoln is going to maybe be helping us a little bit with that, keeping us right. And these are going to be an opportunity to showcase grassroots nursing. What is happening on the ground? We can talk about the big stuff, the policy, but what are nurses and midwives doing on the ground in your area, in your hospital, in your community? And let's hear from them and use that as an asset when we are talking to policymakers or the public or anyone about what nursing is and what impact it has on communities, on population health globally. And that's it from me. Thank you so much. You can stay connected with us on social media. And we are now going to open the floor. Thank you for listening to questions. Or actually, I think what we'll do first is we will hear from Lincoln, Ratna, and Mohamed first. Wow, we've got a full house. That's lovely. There's lots of people here. We'll hear from them first, and then we can take some questions. So in no particular order, I think we're going to go with Lincoln first, if that's okay, Lincoln.
So good. Yes. Thank you. Wow,
Yeah.
amazing. Well, where do I begin? Thank you, Aisha, for that presentation. And as you can hear, colleagues, it's amazing. What are you waiting for? I always say, on my social media, you cannot come and join us. So yeah, my name is Lincoln Gombeza. I'm a registered learning disability nurse. For those who are not following me on social media, you should do, because I talk a lot about artificial intelligence in nursing practice. I mean, nurses, we spend quite a lot of time, with our patients. So we should actually be leading the conversation about AI. So that's what I'm making a case around citizen developers. So, nurses spend quite a lot of time with patients, and we need to be part of designing these systems that are coming our way. Yeah, I mean, when I first joined the Nursing Now Challenge, I never imagined the impact of collaboration and the growth I would experience. So leading the UK's contribution to this global initiative alongside my colleagues, we got Andres Juan from Spain, Margosata Stefanik from Poland. We also had a colleague, Floriana, but I think she's stepping aside at the moment. But we'll be looking for somebody. If anybody's interested, share that good news. But from day one, really, for me, I was struck by the energy, and the vision, and that sheer determination of us nurses and midwives, across the world to push those boundaries, of what our profession can achieve. We are just not passive participants in healthcare. We are the leaders and innovators. We are actually the change makers. So the Nursing Now Challenge is more than just a network for me. It was just a powerful movement that places, nurses and midwives at the forefront of the healthcare transformation. So I'll just touch on briefly on some of the work that we are doing, within the European region. So as part of that, European leadership team, working alongside, of course, Aisha and the team. So I have been, deeply involved in sort of like shaping those strategies, policies, and strengthen our, profession at the regional and also at the global level. We have been with my colleagues working tirelessly to ensure nurses and midwives, are empowered to position yourselves to lead. I know within this call, you got Khadija from here from UK. If we've got more people from the United Kingdom, fine, but we work across all boundaries. So for me, it was really important. I think the game changer for me, where it really, the Nursing Now Challenge, I think Aisha mentioned the health action training hat. You see hat. Yeah, that was very, very important to me, because I was trying to find a space where I can be myself, learning these concepts around meditation and around, the person-centered communication, how wherever you are, in the country, how are we interacting with our patients, and how are we taking that responsibility, when you're working under pressure. But for me, it was, I was born in Zimbabwe myself, so I moved to the United Kingdom about 26 years ago. But what was a reflective moment is in this health action training. We had so many people from Afghanistan, Pakistan, who were taking part, and it made me reflect on the fact that here in the UK, I was complaining quite a lot when I'm in clinical practice and I'm in the ward. I'm like, nah, why is this happening? And then you're seeing other colleagues, who are facing different challenges. So yeah, I went back to my chief nurse. It's there in the article for the nursing times. So Hannah, please, if you can share it in the group. So I want everybody to read that, because it really captures what we are really doing. But I began to reflect on that and see how we can all work together, and less complaining and just let's focus on how we can improve. in the UK, I don't know, a lot of people are not aware. We've had massive international recruitment. So how are we looking after our international colleagues and what is happening in other countries as well? So that is my mentors are always saying to me, nursing is political, Lincoln. So yeah, whether being advocating for policy, for policies for patients, any changes, that's politics. So I'm sure you guys were with Anne Rafferty yesterday. Dame Anne Rafferty who was talking about politics. Unfortunately, I wasn't able to join, but it was amazing. And in terms of engaging, we want our colleagues, you guys yourselves, to reach to your government officials. Certainly here in the UK, we will be trying to engage, with our government officials, our chief nursing officers, around the work that we're doing. How can we push for more equitable healthcare, not only here in the UK, but also for our global partners. So it's been a journey. I think I'll touch on my colleagues, Andres, you will get to see Andres at some point. He is amazing, I think working alongside him, it's been very inspiring. He always tries to bring us together. We got a sort of like a WhatsApp group where we are communicating some of our ideas of what we're working. He has deep experience, healthcare policy, system leadership, and really driving those strategic decisions, and Magozata as well, amazing. I think she's a midwife as well. She's really playing a leading role in helping us, shape some of our objectives. She loves research quite a lot. So, please do follow her on social media. So yeah, I mean, I know I only got 5 minutes to talk about my experience, but for anybody who wants to really talk, I mean, join us. It really shaped me to be a leader, to be an advocate, and also to be something that I'm now calling myself an AI innovator.
Yes.
Technology. So be an innovator. We can do it. You are citizen developers. Anybody. I think what is happening now, technology has democratized everybody to take part. AI can just really help you to do quite a lot of things. So just one last point is we do have a workshop coming up very soon, which is around AI, and we want everybody to join, share with your colleagues, and don't forget to let your colleagues join the Nursing Now Challenge. You are missing out on opportunity, especially here in the UK. Our students, my students, who are here on the call as well. We are really encouraging them to start registering and join. So that's it for me. And let's see if I missed anything. Any questions, anybody?
Oh, thank you. Thank you, Lincoln. I think we'll maybe keep the questions to the end just so that we can make sure that they hear from everyone. I know it's a tight squeeze, and I know Zipporah's joined also, which is fantastic. I'm going to go to Mohamed next, and then we'll go to Ratna, and then we'll look for questions. Thank you.
Hello, everybody. Good morning, good afternoon, good evening from where you are from the part of the world. Thank you so much, Professor Aisha, for giving me the chance to show up here today. And thank you so much, Lincoln, for the motivation of work. I like the way that you have crafted your story about health action training and how you are leading the AI innovator. So keep up doing the good work. So in brief, my name is Mohamed Mudbir. I'm a community health nurse by background from Sudan, graduated in 2022 from University of Khartoum, and worked in several parts in nursing career as a clinician, emergency room, as Professor Aisha introduced me, then shifted to work with NGOs, with governmental institutions, currently doing my master's program. Uh, my experience and journey with Nursing Now Challenge has begun earlier. So I think it started like 5 years or 4 years ago. So it was really transformative experiences. I had the opportunity to explore all those training that Professor Aisha has showed, from health action training, from vaccine Nursing Now Challenge Global Solution Initiative to be Challengers Committee. I also forgot to mention that I am one of the co-chair of the Africa Hub Challengers Committee, together with my colleague, Zipporah Oragi, which is here in the call right now, Cecilia Ndongo, both of them from Kenya, and Maureen Mausi from South Africa. So basically, I had the opportunity to be working with Nursing Now Challenge in various activities in terms of I'm a first cohort winner of Global Solution Initiative in collaboration with Sabin Vaccine Institute. We had the opportunity to implement our project about tackling vaccine hesitancy and equity in my local country. And that was amazing cohort that shows the integration and collaboration between all nurses from different parts of the world. That was my first time to interact with Amy from USA, Rafiat from Nigeria, Rashid from Malawi, and others. And that was transformative experiences because at that time we had the training to develop the leadership opportunities and how to know how to build leadership training. If I remember well, that training was delivered by People Power Health by Beja at that time. So then, with over the time, I had the opportunity to join the Challengers Committee together with my college phase. We had done amazing work in the past in terms of launching nursing and midwifery governance and leadership paper on the Africa region. That was the greatest achievement with the general support from Nursing Now Challenge and Party Trust for Nursing. And also Nursing Now Challenge was contributed for me at least to reshape my mindset, my ideas, and my leadership capacities. And the more things that they had the opportunity to show me the collaboration with other nurses from different parts of the world. As through Nursing Now Challenge, I was able to implement an activity in my home country. Then I had opportunity to speak at international conferences like the ICN when we speak about the ICN about our vaccine hesitancy was online during COVID time, I remember. And then we had opportunity to showcase our effort together with other amazing colleagues from Voices for Vaccines at highest level. Some of them presented at UN in USA, and some of us has presented at World Health Assembly or World Health Summit in Qatar, and other colleagues also have joined Berlin, World Health Summit in Berlin to show up our good work that we do. So for me, Nursing Now Challenge is a transformative and collaborative approach that aiming through to achieve the empowerment and leadership for nurses. Through that, and I had opportunity to shed up the light to reflect about the challenges that I have faced in my country. And I need to mention a very important point that one of the webinars that we have is Nursing Now Challenge if I remember well, with Harvard Global Nursing Leadership Director and the head of Harvard Public Health School when she spoke about we need more nurses to be in the health policy and to prepare for the next pandemic. That was a triggering point for me. Now I'm pursuing Master of Public Health. So I'm trying to highlight here is that all my career has been shaped through Nursing Now Challenge, and Nursing Now Challenge giving me an opportunity to be the person that who I am. They provide endless support and they provide a network that from people that I would never be able to reach to them without Nursing Now Challenge, alongside the training, capacity building, health activity training, and now they still are continuing to provide leadership training. And I see Nursing Now Challenge are expanding right now. We have like global books, we have like debates right now, and I'm looking forward to the AI and podcast for nursing. There's a lot of effort. Alongside of this, the resilience of Global Solution Initiative has been expanded in terms of like new activities like the people who are taking the vaccine, the second cohort, and then we have like human papilloma viruses, then we have disinformation and pandemic records. All of those activities reflect that the importance and the showcase of nurses to be in a global level and their voices to be here because what's come to the policy and leadership that something need from us as a nurses to be prepared because when we want to speak about these policymakers and politicians, we need to reflect our point. So Nursing Now Challenge prepare you to be ready to take the opportunity to raise your voice for the nurses. And I encourage everyone to join Nursing Now Challenge and everyone to be involved. And you are more than welcome to join Nursing Now Challenge. And I think Hannah will be able to drop us links to join the Nursing Now Challenge. And thanks, that's all. I hope.
Wow. I mean, so inspiring, isn't it? I mean, really, I wish it's wonderful to hear you speak to people who have joined today, Mohamed and Lincoln. And what I wish for most is that senior leaders, governments, people who influence policy, people who make decisions about investment, if they could hear you, and that's part of what we're trying to do, elevate you and your exposure, they need to hear this. They need to see this is what the current early career nurse cohorts across the globe look like when they are given an opportunity. They are ready to take it and they want to take it, and they can so help in so many ways in our profession and the challenges we face. And we can't be forgotten. And your story is so wonderful. It's humbling for us in Nursing Now Challenge, because at the end of the day, we can give opportunity, but you as individuals have to take it. And sometimes that has to be about being brave. That's about being comfortable with being uncomfortable, putting yourself out there. And that's what we want to happen. We want you to do that. And often the decisions and the opportunities are held by people, and sometimes nurses who are more senior, who say they're too busy, but you're not too busy. And so we have to change that mindset. And it's just fantastic what you've done. And the consistency of just sticking with it and progressing your career. Look where you are. It's wonderful. And you have made that happen. So thank you so much for sharing that. That is absolutely wonderful. You're just joyful to listen to. And I hope you've inspired everyone listening today. We are finally going to hear from Ratna, our newest member who has joined. And Ratna will introduce herself. I'm lucky enough to be Ratna's PhD supervisor at the University of Edinburgh. I first met her about 3 years ago when she came to do her master's. And she was a wonderful student then, and she went back to Indonesia, and she came back to me. Which is wonderful. So here we go. Let's give Ratna the floor. She's just new into being part of the Nursing Now Challenge family, so we're giving her lots of support and wishing her lots of kindness and goodness in the next 5 minutes. Thank you, Ratna. Over to you.
Okay, thank you. Can you see my slides? So, yeah, it is really a great opportunity to join as the Challengers Committee and be the co-hub leads of the Southeast Asia Regional Challengers Committee. So, everything started from 26 September of 2024, and it is really game changing in my life, because from this moment, like, I meet a lot of people that is really incredible, from the Challengers Committee, from the Nursing Now Challenge networks, and also from all of the leaders around the world. Since then, there are lots of things that happen. First of all, I got a lot of incredible sessions, like the book club sessions, the webinars, the seminars, everything that is happened in the world of nursing. I think it is happened in the Nursing Now Challenge. I also got the opportunities to meet a lot of incredible people, incredible authors that are also the incredible nursing leaders from all around the world, from the WHO, from Dr. McCarthy, and all of the people that's really inspiring me, in even when I just met them first. And it makes me want to keep going and like championing nursing in my country and even in the world and also in my regions. Also, there are a lot of course, and one of them is the leadership course that I am now trying to complete this course. And this is really amazing because they're assessing about my leadership, and also they are trying to makes me become a great leaders. And this is really influential in my life, because at this moment I can like understand myself more. And when we can understand ourselves more, it makes us know how to drive ourselves and how to make ourselves better in the future, and also how to make ourselves makes our environment better. And it is really good. And there are also networkings, and it is really good. We have more than 200,000 members. We have also a lot of challengers committee. We have also a lot of countries that joining us. It means when we have some things and we want to do some things, we can be supported really in a maximum way. For example, like in this Southeast Asians hub, we have these upcoming seminars, and it is really easy to find someone who want to speak for our seminars, because we have a lot of networks that can join us and a lot of people who want to share. And also friendship. like I've got a lot of friends from the challenges committee. I got a lot of members that also want to join this Nursing Now challenge, and we talk a lot about this how to drive the betterment of the nursing in the future and something like that. We have the shared value, the shared visions about nursing in the future, and that is something that you cannot find only in your daily basis. I mean, if you are only like have the friendship or networks or friends with your college in the work or in the school, maybe they will not talking something big, just like how you find it in Nursing Now challenge. So this is really a game changing if you join Nursing Now challenge. Also, this is the plans for the Southeast Asia hubs. First, we are creating and managing the hub's social media to expand reach and provide broader perspective and informations. And also, we will have an interactive international seminar and discussions on the global overview of nursing and midwifery. And we have also discussions on a nursing issue in Southeast Asia every month. And also there is a disseminations of the monthly discussions on our social media platforms. So all of this is to provide, like, for example, if you want to know more about the issue in the hub, or especially Southeast Asia hub, you will be able to access that from our social media. And also, if you want to join the discussions, it will be really great because it will give big insights and also big discussions and debates and everything that can become something that insightful for you to lead yourself and also to lead your environment in the future. And yep, that's all. So even if I just joined this Nursing Now challenge for a couple of months, I feel really supported. I feel really like this is my home where everyone's have the same visions. Because when I talk about the things that we are talking in Nursing Now challenge about the future of nursing, about what we can do in the future for the nursing's future, about what young nurses can do. And we talk about this with like not a Nursing Now challenge members, for example, like my college or some friends in my hospital. They will like, oh, I don't have time to talk about that because I'm too busy or something like that. But when you are talking in this platform, when you are joining Nursing Now challenge and you have these big motivations, you want to be better, you want to be a different person, you want to make nursing better, not only an ordinary one, but also the extraordinary one. This is your place. So join us and be heard. Thank you.
Absolutely wow. Oh my God, the three of you, just absolutely amazing. I mean, how good is this? It's great. It's just brilliant. Just such fantastic stories of from all three, from Lincoln, Mohamed, and Ratna, who's just joined just recently. And Ratna, I'm so glad that since September, in these few months, you're starting on the journey that both Lincoln and Mohamed have experienced. And the more nurses that have this opportunity, then the more our profession will benefit and the more people will understand and know what we have to offer. And I love that you have identified friendship. You find this place, you describe it as my home, and you've said this is your place. And that's what we want Nursing Now Challenge to be. We want it to be a place that people feel that, because often in our normal workplace or study space or colleagues, you're right. People say, I don't have time. But actually, if we make time for this, our lives will be transformed and our professional we will be transformed. From a few people, we will grow into a bigger movement of change together. That's the only way we can do this. So it's wonderful. The three of you are just fantastic. And I'm delighted that you've had the chance to speak today. I just want to open the floor to see if there is any questions from anybody for Lincoln, Mohamed, Ratna, or for ourselves, the Nursing Now Challenge team, about joining the Nursing Now Challenge. If anybody is there with any questions for us, please just pop them in the chat or put your hand up, and we would prefer if you could possibly put your screen on. That would be wonderful. I love technology, but the one thing is, when you're not in the room with people, you can't see their eyes and their faces, and we hide behind our screen. So I know it's internet connection sometimes that's the issue, but if possible, it would be lovely to hear you in person.
Seems like there's a question in the chat.
Lovely. Thank you so much, Faye. Seema, thank you, Seema. I would like to know details about the AI workshop, which is upcoming, discussed in the previous presentation. Seems innovative. Lincoln, do you have more details of that? The AI workshop? When is that running? What is there a date? How do people register for it? Would you be able to help with that quick question? Thank you so much, Seema.
Yeah, thank you for your question and the enthusiasm for AI workshop. Yeah, we aiming for March. We just doing the final details. You'll get more information from the Nursing Now Challenge team. Be on the lookout. I'm not sure whether you joined the Nursing Now Challenge yet, but make sure you're registered. And if you've got friends or other nurses, make sure they do register as well, because this is going to be a game changer for you guys, citizen developers. So it's going to be very interesting. We hope everybody's going to join, but more information will follow via email.
Lovely. Thank you, Lincoln. And yes, same, I don't know if you are a member. The key thing is membership. There's no fee. There is no form filling in terms of signing up and having to give lots of information about yourself. You literally register online on the form, and if you're an individual, you tell us if you want to be part of the Challengers Committee. There is no commitment in terms of your time. If you want to sign up for the Challengers Committee, obviously there is more activity going on there, but you join and you receive the information, and then you take it from there. We are not telling you to do anything. We are just offering you opportunity, and we are offering you possibility. And what we suggest is that you take that, because there's not a lot of this around, and you can see what happens if you do. You've heard from Ratna, you've heard from Mohamed, you've heard from Lincoln. And can I tell you, there are hundreds more. This is not just 3, there are many more who are absolutely the same. And we have many more who just have never had this opportunity. And part of our legacy, I think, as someone more advanced in my career now, part of what I want to give back to nursing is I want to ensure that the current and future generations who are here, who are about to come into nursing, have these opportunities. And that is what my mission is, to ensure that that happens. Because one more nurse, as our wonderful Amy said, just one more nurse will change the world. And if we all had one more nurse and just one more, then can you imagine what we do? We are already the largest health workforce in the globe, on this planet. If we come together and if we understand what our strength can be, we can change and move mountains together. I think there's another question in the chat which is being dealt with. So what's the criteria to be a member of the Challengers Committee? Farah, delighted that you're asking that question. That is wonderful. So you need to be a student or a registered nurse, early career or midwife, motivated and keen to engage with activities. We ask that you send your CV and a couple of lines about why you want to join. But the first thing you need to do is register first. You need to register online, and then we will email you back about it, but that in general is what happens. Deirdre, you've got your hand up. That's wonderful, and we can see you. Delighted to meet you. Thank you. What is your question?
Well, first of all, I just wanted to say that I think, as I mentioned in the chat, I'm, really blown away by Ratna, Lincoln, and Mohamed, by what you've said today. And, it's always nice and inspiring to hear about nurses that want to take people with them, and that's a very, very generous approach, and much needed approach. I suppose I just wanted to ask what, you mentioned that you're from, very different parts of the world. Some of you are based in the UK, but what you see as some of the kind of unifying challenges that nurses, across the globe, I know that some of that will probably be addressed in the new SOAN report, but from your point of view, what are some of the main unifying challenges? And to preempt, I'm not sure if Lincoln, you might say AI, but yeah, just wondering. Thank you.
Lovely. Thank you, Deirdre. Great question, and thank you for your very kind words. And this idea of generosity. I mean, that's it, isn't it? If we were all generous, as nurses with our time for our early career nurses and midwives, that would go a long way, and they are generous with each other, which is wonderful. So I don't know Lincoln, Mohamed. I mean, Mohamed is, has a lot of experience of very challenging circumstances. Ratna is over here studying in the UK, and Lincoln has also been a nurse who has moved. So Mohamed, you maybe want to say something in response to Deirdre first, and then we can hear from Lincoln and Ratna just in the last 5 minutes.
Thank you so much, Aisha. Deirdre, is that a very tough question? Because we are here like an international student or international nurses. I mean, like there is a global challenge that every nurse in every part of the world that has been facing. To be honest with that, the challenge of work overload, the challenge related to payment, challenges related to human resources, challenges related to nurses' voice are not heard at policy level, challenges related to leadership and everything. And nursing now challenges provided like the platform for all of us to share our experiences from different perspectives, from different challenges. For me personally, the main reason that I'm joining Nursing Now Challenge because I have like challenges that I faced in my real life, in my country, Sudan, since I'm a student. Then I just tried to sign a place that could help me to align with the solutions that I could help. For example, in my country, we have a problem related to nurse care workforce shortages based on a previous ICR report, which is indicated that we are underpaid, we have nursing shortages. On the other hand, we have high nurses that are graduated from my country and they go back to work in migrate outside of the country. So that was a key challenges. For me, I bring that challenges with me with Nursing Now Challenge. Then I realized, okay, I need to take an opportunity to step up to face that challenge. So I move out from a clinical nurse to work at Ministry of Health to understand how policymakers are thinking regarding nurses recruitment or something like that. During the working my Ministry of Health, engaging with Nursing Now Challenge webinars, exchanging and hearing from experts, as I mentioned earlier, like Global Health Nursing Leadership Program by Hartford People, they are indicating that nurses need to be more work toward the field of public health and health system strengthening. And meanwhile, I'm a nurse working at Federal Ministry of Health. I experience a big challenge is that because when I come to the meeting and I bring my viewpoint from a nursing perspective, they say, you are a nurse, why you are coming here to work as a Ministry of Health? This is not your place. You're supposed to be in the work. Actually, you're supposed to be in the hospital. So that made and I make a valid point. And to be honest, they're afraid to say it publicly, that's politics. But in person, they come to you, okay, you make a valid point, but usually they ask in my qualification, you are just community health nurse by education and you are trying to interfere with policymakers. Then I decided to jump up to the next step in my career, aligning with experience that I received from webinars on Nursing Now Challenge. I had to decide to go for the Master of Public Health, which is the thing that I'm doing right now. So I'm currently doing for Master of Public Health. My intrinsic aim behind that to improve nursing situation around the world because I wanted to know how health plans are made and how human resources are financed. On the other one, how health policymakers deal with nursing problems. So now I'm enjoying the master's program and hopefully in one day I could be able to change that situation. Here, as Prof. Aisha said, just nursing now will put the light for you, then you have the opportunity. Just say nursing not like a scandal, so you have to take that scandal and to go out to face the world. So that basically is that what I'm trying. I hope that I have answered your question.
Yeah, very much so. Thank you very much so. Thank you.
Wow. I mean, just it's just actually fabulous. It's absolutely fabulous listening to you. And Mohamed, therein lies the issue, I guess the issues and the challenges, but also the solutions. And we can spend so much time focusing on the challenges. And our challenge at Nursing Now Challenges, we're challenging you, we're challenging everybody. Let's move from the challenges and the problems to the solutions. And you see, we're seeing education, knowledge, research. If we want to be part of the solution, we need to understand what is going on in these places, in the rooms that we are not in, what's happening in the room next door where the discussions are happening. And we need to ensure that we are educated, we are knowledgeable, we have the data. And that is why, when nurses say research, what's that got to do with me? It's got everything to do with us. Our practice is evidence informed, but also influencing policy. It should be driven by data and the evidence. And we need nurses. It's like Mohamed said, they're like, what are you doing here? And it's like, okay, you're going to listen to what I've got to say because I have the ideas. I have part of the solutions. And don't ask for permission. We're, as nurses, I think historically linked to Anne-Marie's book, we're socialized. Our identity is that we are substandard in some way, or we have to ask permission or wait for people's permission. We don't. And unless we start taking control of it ourselves, we won't ever do that. But this group, they are doing it. And it's not going to happen in 1 year or 2 years. It will be a generation, but now is the time, and this is the generation. And if you see the front cover of Nursing Times, the headline of that image was "Ones to Watch." They are changing the world or the globe nursing. This is it. They are doing it now. I think that's a great place to end. A fantastic question, Deirdre. I hope everyone has enjoyed. If you do one thing this weekend, just register. Just do it. There is nothing bad is going to happen if you do that, but only good things will happen. Thank you so much today, everybody. Thank you to Hannah and Faye, who were managing everything behind the scenes. Thank you to everybody for taking the time in different parts of the world. Hopefully we have sparked your curiosity. You've heard these wonderful stories from the people who are doing it. And if they can do it, then your colleagues, early career nurses, organisations can do it too. So thank you so very, very much. And for Ratna, Mohamed and Lincoln, a round of applause for fantastic, fantastic narrative presentations. We value your time and your energy. And just by being here today, you have changed more nurses' lives and patients' lives. Thank you so much. Take care. Bye.
Bye. Thank you.
Bye, everyone. Bye.